player of the year, as they say in sports communities. Because if you know the political situation, or if you know the financial situation, social, or whatever I've written here on the slide, you need to be more collaborative. You need to make the right networking. You need to be visible. And you maybe need to show also some spokespersons and with a very clear and short agenda when you meet people. If someone is calling you from the national television and say, hello, I would like to have a comment from, it's the international, it's the World Stroke Day, like it was the other day. Who are you going to send them? Is it you? Is it me? Or is it actually someone who has been living with stroke, who is an excellent person to present both the situation and the disease? Because it's not only about also to have a personal story sometimes, you need also to be able to present what does it mean to you to have this kind of condition, how it affects the society. We saw figures earlier today by the professor, and know how cardiovascular diseases and other diseases are affecting society. So you need also to have these kind of spokespersons, and maybe not only more than 3 points on the agenda for people to remember what they have said. I think also that you need to think about, is it an obstacle or can I provide a solution? You know, politicians, they love solutions because they cannot find out all of it themselves. So they need to hear from you. What can we do then? If we have this, package coming now from the UN and the World Health Organization to all countries, social and healthcare department, the ministries, and they will say, okay, what are we going to do? We need to be in touch with all the patient organizations. My God, how many are they in our country? And who should we talk to? Okay, then you should make yourself useful. You should be the one that okay, we are ready to take on this duty. We know this area, and we also can recommend a few other people within the patient community that can be very, very good and helpful in this work. Okay, that's good. Maybe your health minister can also create some kind of patient council. I know the Swedish Minister of Healthcare has had it for maybe 10 years. They change organizations or representatives every second year. So it goes round, and they have a lot of people, trying to tell about new things coming in healthcare and what's happening at the EU level and so on. So I think there is, of course, you can see all the obstacles. But when you also think about how would you like to have the solutions, you can also make a great impact. You will be the one in the TV sofa. You might be the one that also is, at the very high level in your country because you have made yourself useful and valuable to decision makers. And without you, it would not have been that good. So that's my very practical advices. And if you'd like to know anything more, you will, because we will also have a panel. So thank you so much for listening.
Sit down for a second. We're so lucky, aren't we, to have somebody that's been on that side and can tell us these really top tips about working with politicians and government. And it all rings true to me as somebody that's worked as a civil servant for ministers. It's going in with your absolute game plan, having it short and sharp, knowing the solutions. Can you give us any examples, Claire, of times when, you know, you've had something presented to you in exactly the way that you want, and you have been able to run with it and create actual outcomes in terms of patient-centred care or patient-driven initiatives? Can you give us an example of something?
Yeah, well, an example very relevant to this discussion about LCDs. I would like to highlight the very important work done by the Swedish Asthma and Allergy Organization. They have been crucial, you know, in the work to ban smoking both inside and outside and in public buildings and also in restaurants. And it has had a severe, very important, you know, impact to public health in Sweden. So I think when people are very clear in what they like to see, and they have good examples, some facts and figures, as I said, it's important for me when I was a policy maker. Okay, I understand this. I can see how it works, and we can make a change. So this organization is really coming with something, you know, they handed it over to me and other members of parliament, and it was like, you know, having a gift because it was so well presented. So when that happens, you know, it's not that difficult to be able to do something.
Thank you. And I think people should understand that our politicians have so many demands on their time. And certainly was quite surprising to me to see like cabinet ministers in the UK having to respond to the Prime Minister, to the whip, to their constituents, to the people in their department. And so that's why you have to go in with just this short, sharp, evidence-based plan, like a business plan almost, which makes complete sense. In the interest of time, I'm going to introduce you to our other panel members. Panel members, please stay where you are because of the activity we're going to do shortly afterwards. But I just want you to know a little bit about them. So, first of all, forgive me because my internet's gone down up here. We've got Khan. Khan, you've heard from this morning. He's stepped in for Begona, who sadly can't be with us today. Khan is an organisational psychologist specialist. He's the founding Secretary General of Red Ribbon in Turkey. Throughout his career, he's experienced key roles in both the private sector and a number of NGOs. He's also a member of EATG, which provides activism and strategy consultation on chronic infections such as HIV, hepatitis and TB, which affect public health, especially amongst young people. So really great to hear from him. He's also just finished his PhD, so grab him afterwards, he'll be able to tell you about that. We've got Evangelos, who's Philopoulos, who's from the Hellenic Cancer Society. He is, such a wonderful panel, a distinguished breast surgeon and a central figure in the field of cancer treatment, combining extensive medical experience with a strong leadership spirit. He's been involved with the Hellenic Cancer Society since 1986, so an awful lot of experience. His career path includes specialising in surgery for 6 years in West Germany. He dedicated 33 years to the Aegeus Savas Cancer Hospital. Forgive my pronunciation, I'm sorry. And served as the director of the breast clinic and as a member of the board of directors for 10 years. He's also held a position as president of the educational committee of EKAB, where he was responsible for the training of ambulance crew members and is the creator of the first autonomous surgical daycare unit, which later evolved into the renowned Nikos Kokoulos Day Centre in Athens. He's worked as the director of the breast clinic at the Athens Euro Clinic, and after many years of commitment to the HCS, he's served as its president since 2014. So extraordinary career. Then we have Vanessa Potts-Samedi from the Beringa in Ingelheim. She is the head of global patient engagement. Also so experienced. Her team aims to strengthen the collaboration and partnerships with the patient community and systematically integrate patient and caregiver insights into the development of new drugs and foster a patient-centred culture within the company. Until recently, she was also the Global Patient Engagement Lead for mental health, retinal health and emerging areas. Before moving to Beringa in 2021, Vanessa specialised in patient insights and advocacy at Merck. Prior to working in pharma, she helped to build out Edelman's global specialty practice for health systems, health policy and patient engagement. And I think, having spoken to her at breakfast, one of the things that she's most proud of actually is being a caregiver to her brother who's got a rare chromosomal condition and multiple complex medical needs. And that, I think, drives her passion, and I saw that coming through when we spoke this morning. And then finally, we've got Amanda Bock from the Synergist. She's a recognised thought leader in the healthcare community. She has worked in international patient advocacy in the area of rare bleeding disorders since 2009, first at a global level and then at a European level, where she was CEO of the European Haemophilia Consortium for over a decade. Her professional path has been informed by her early career in international humanitarian diplomacy, working with EU institutions, the Red Cross movement and the United Nations system, as well as by her personal journey growing up on 3 continents. Amanda has driven work through collaboration, co-creation and collective action. She holds a Master's in Environment and Development from LSE and in London, and a BA in English and International Relations from Austin College in the US. She's also a member of the senior leadership team at Synergist. And I've told you all of that because I'm not sure we know enough about each other in this room. So I wanted you to know about the people you're going to speak to in the next 15 minutes. Because what we're going to do now is I'm going to ask each of our panellists to take on one table. There's going to be 5 tables in the room, not 6, I'm afraid. So I'm going to ask you to move. And each one of the panellists is going to take a different question, and then I'm going to ask them to come up at the end, feedback on what their discussion was like, and also provide their own thoughts on what they've heard and what they want to bring to the table this afternoon. So before we start moving, I'm going to be really bossy. Please stop moving, stop moving. So Penella is going to take a discussion on advocating at a national and European level, taking on board what she was just talking about. I want no more than 4 or 5 people at each table, please, because there's not enough of us in the room. So Penella, can I ask you to sit at this table at the front? She will be discussing European and national advocacy. Khan is going to be talking about the patient voice, so strengthening patient-centred care at the patient level. He'll be talking about patient advocacy, top tips at that individual level. So Khan, I'm going to ask you to go to the second table, please. Then we've got Evangelos, who's going to be talking about turning some of the barriers or the pitfalls of person-centred care into positive opportunities. You're not allowed to go away, there aren't enough of us, you have to come back. Okay, Evangelos, he's already positioned himself at the back, so he'll be over there. Then we've got Vanessa, who will be talking about embedding patient advocacy into policy making, so very practical tips on how to do that. And Vanessa, if I can ask you to go to the table at the back. And then finally, we've got Amanda, who's going to be talking about person-centred care and how it's competing against a multitude of threats as we move into the short, medium and long-term future. These are things like socio-political threats, environmental, climate change threats. And do we need to start thinking differently about how we do patient advocacy? So I'm going to ask you, Amanda, to sit at this table, second from the front. And this table here will be free, so no one will be sitting here where you are, Yolanta. Okay, yes, please. I'm going to give you 15 minutes. What? No, Park, you should be here. Oh, it's fine. Stay where you are, Vanessa. Amanda, you move there. So, no, sorry, second table back. Great. Now, I'm really going to apologise to the people online who can't join us for this. Unfortunately, our technology doesn't allow us to do it. But I'm going to give the room 15 minutes. So those online, please take 15 minutes break. Come and join us again after.
You just put it online. 15 minutes. Work group work. Hello. Hello.
I'm falling asleep. I fell asleep 5 times.
Yeah, we need to take pictures of the group work. Just I need your camera again.
How does this work? You've got 2 minutes left, 2 minutes, so start wrapping up your discussions, please. 15 minutes goes very fast. Okay, that's your time up, so I'm going to ask the panelists to come to the front. Angela, Swan, Amanda.
Okay, so we are all set.
Yes.
We are using, and
Yeah.
we're going to use the other mics. If they don't work, then I'll have to put this there because online people will only be from there, otherwise from there.
Okay.
No.
So let's come back into the room. And I'm going to ask Penella to come up. This is a bit intermittent. I'm going to ask Penella to come up and give her reflections first on what her group discussed, which remember was about advocating at a national and European level. So Penella, can I ask you to what do you
We were talking about what I was presenting, to have solutions and not present only the problems. And we had some experience in the group from that, from working with governments and decision makers. And you can be an expert, you can be someone that people are calling for and to be, well, as I said, be valuable. But you need to know when to step back. Because if you have provided all the good things to a policymaker, you need also to step back sometimes because the glory should be at the policymaker, not at you. And you are just providing information and not, being in the center of the solution afterwards. So that's very important to remember. And also that the topic is not, maybe the topic you bring is not interesting to people unless they are affected. And I think it's so for all of us that we don't know about some diagnosis and so on, and we don't care actually, unless someone in our closest family or relatives or friends are affected by a disease. So we need to know that the public and also decision makers are working in the same way.
Thank you for really good reflections and follow on from your presentation. Thank you. Because you were covering off patient-centred care at the patient level and some practical tips. Can you think about what your discussion had?
Actually, we discussed that to bring the idea of patient-centered care to the healthcare systems is all about teaming up with the healthcare professionals to certain engagements and also partner with the healthcare systems and authorities in our own countries. And also that needs to be a recognition among the healthcare professionals about the patients. This means patients need to understand the medical literacy. They need to be educated. This is achievable, actually. When you understand the medical literacy, you communicate with the medical professionals easily. They understand, and also they like it. They like to be understood in their own medicine language. So, and it also will lower the patronizing the patient from healthcare professional perspective. So in the end, I can say that we argue that there needs to be a partnership between the patient groups and healthcare professionals and authorities.
Great. So something about speaking the same language, really,
Yes.
and being able to have impact because you're speaking the language of the other person. Yeah, that makes a lot of sense. Evangelist, you were discussing turning some of the risks around patient advocacy into opportunities. Can you tell us what you were talking about?
First of all, there was the point that the patients must collaborate with physicians, with doctors. It's very important not to forget the medical experts. They must collaborate with them, and there is a need for networking and international collaboration to begin strengthen our efforts and to make the policy makers that they are not in every case ready to adopt our proposal. And there is a doubt about patient-centered care or participation of patients in the healthcare. The patient is in the middle. The patient is the person of interest, but the patient-centered care may be confused the real participation of the patients in the process of care. So we can explain to the people, and I am very good to hear that everybody is a candidate to become cancer patients, to become health patients. It's all the civilians, all the people are candidates to be patients. So it is a real political issue, and we must consider when we're talking about political parties and so on, what are their theses, what they want to do in healthcare. It's very important. And the use of data, we have to give data to the AI technologists, to the pharma industry, but must be anonymized, and we must be very careful not to be misused for our personal data in the future. This is a danger that we must be very aware, because it is not so easy. We try to destigmatize cancer, but we see that when the people return to work, they said, Anna had breast cancer. We cannot do it director. And they made director Costas. And Costas, after 2 years, became a health in practice and go away. And Anna became older and come to the pension, okay? Also, we want to destigmatize some kind of cancer patients, but other are also conditions. I'm a diabetic, okay? I'm a patient too. I have 2 stents in my coronary arteries, but I'm not stigmatized like are the cancer patients or other illness. So we have to try to reform the way people is thinking about illness. That is a duty that we must do. And excuse me for the time Balkan people speak. We heard about children and adolescents and young adults. Children, 70 to 80% are healed, are cured. The problem are the parents and the survivors after 20, 30 years. What are the side effects of their treatment? The adolescents is a rarity to see cancer, but the young adults is rare. And now in some cancer becomes more and more, we have more cases. And these are very, very difficult cases. We need to support these patients. I told you a lot, eh?
It's such a good point. We sometimes forget that our doctors have been patients as well. And when we talk about person-centered care, we're not saying patient or person-only care, are we? We're saying in collaboration at all times. And as a doctor, can I ask you, what does the perfect patient partner look like? What do you look for in a patient who is collaborating and being helpful, but respecting your role as the doctor and physician?
First of all, doctors, from my experience in my country, the last decade are not communicate well with the patients, and that's a problem of doctors. They must have a communication lesson in the university. We try as Cancer Society to give lessons to doctors to communicate with patients. First of all, also the doctor must speak the language of his patients or her patient. The other side is that there are patients that are very nervous, they are very anxious. The doctor must come to the side of the patient, not the patient. The patient is the patient. There has his problem, her problem. We have doctors that say to a woman that come too late with breast cancer, why you come so late? Why you? It is not a precursor, you know. It's not a just.
It's not helping.
It's there to help the patient. Also, the main problem is not the patient, are the doctors, how they communicate with the patients. I'm a doctor, but I say the truth. Okay.
So we sort of covered off, we're going from this sort of macro level all the way down here. We've talked about the European, we've talked about the patient voice, we've talked about the individual and how they can work with the physician. I'm now going to ask Vanessa, who's got a couple of slides actually. So Vanessa, do you want to come up and talk through what
I
you say?
think I have to do it. Yeah. So, but first I just wanted to briefly summarize what we talked about at our table, which leads very nicely then into my slides. So, we had the topic of how can you really bring patient advocacy to policymakers? And at my table, we had a few different countries represented. We actually heard how challenging it also can be when the political system does not have any formal pathways for interacting with patient advocates. But I was very happy to have at the same table also some experiences for informal engagement and informal policy change, where you can also work through some creative actions. So there were some really fun examples from Ravi that shared work that they're doing in Afghanistan. I mean, of all countries, right? What do you expect there in terms of political system for patient involvement? But you know, you can work informally. In his case, he said there was some work going on through Telegram channels, working with women, sort of in the underground. I thought that was a really smart example. And what we heard were just three things that I will take away and see if in the meantime I can also open the slides. When you really want to bring patient advocacy into policy, there's three things to consider. One is you have to be grounded in the personal story. The personal testimony is still the leading dimension. We need to listen to the people with a lived experience to inform the advocacy. But second, we need the data as well. And so there has to be efforts from patient advocacy organizations to really capture in small ways. Could be a survey, could be just a little questionnaire that you hand out at a meeting to your members. You have to capture the quantitative and the qualitative data to substantiate the burden of your condition, to bring that to policymakers like Pernilla. And then the third one was also, this goes back to Ravi's contribution at the table, be creative in your approach, use digital tools in your approach, really think about this out of the box. And I will go straight into my slides also, so thank you for my great table. As you heard initially, I work for a company, a German pharmaceutical company called Boehringer Ingelheim, and we lead something called the Global Patient Partnership Initiative. And what I distributed earlier at different tables is a white paper that we just published, where we make exactly that case. You can see this picture here where we launched the white paper September, previous month, in New York during that UN General Assembly week. And we're making that case in this white paper as to why governments should involve patients in designing policies that are for the patients. And it's really a business case for governments, for policymakers, that helps them save resources. It will help them allocate their resources in a better way. It will help build trust when patients are involved. Other patients are more likely to then actually go to that screening program or use that health intervention that you're proposing. And of course, this will improve health outcomes. And what governments are very interested in these days is economic resilience, right? If they take better care of their people, they will have, better economic resilience as well, which is something we must not forget in our advocacy efforts. And now just wanted to show you, how did this even come about? Why did Boehringer have such a paper? And you can see here that this is really a collaborative effort. So it started with the Social Participation Resolution 2024 that Amanda already mentioned yesterday, I think. And we looked at that with our partners in the Global Patient Partnership Initiative. and had a partnership specific with the NCD Alliance in May of this year in Geneva at the World Health Assembly to just have a public conversation around what are some barriers, why are policymakers not bringing in the lived experience, why are they not sufficiently listening? And we took that then further, worked with 100 advocates throughout the summer to really listen to country-specific examples of what are the challenges, but really importantly also what are the solutions. And you can find all of that in that white paper. So there's different building blocks for how this can be done. I will not go through them all because I gave you the paper so you can read it, but also the case studies, and they cover more low and middle income countries and more developed countries as well, to show that the lived experience can really guide policy in no matter what healthcare setting. And really, this is now with you. I've put the white paper on the table. You can also, everyone who's watching online, download it by scanning this QR code. And the question really would be, let me know afterwards. My email address was included. If you find it helpful, and think about maybe how can you take it to your communities. It's really disease agnostic, country agnostic, and builds a little bit on the conversation we had at the table.
Thank you, that's great, and good to have some resources. And then finally, Amanda, you were discussing at your table how we redefine patient advocacy in the light of the sort of threats that we're facing now in a wider context. Can you cover off what your table discussed and any other thoughts you have?
Yes, thank you. So we had a fabulous table of two. And there's a lot of threats in the world right now. We didn't really get to all of them. I think the key takeaway I'd love to share with this room is we discussed two threats, one a little bit recently historic, another one further away historic. But the takeaway is that both of them were silver linings that could be used and could be leveraged. And I think that's the key message to give to this room. So we had a COPD and an asbestos examples. And the connection between them really is COPD is more in the spotlight because of COVID. COVID is a terrible tragedy that came with an important silver lining. One of that silver linings is that it highlighted respiratory disease and respiratory burden. And in a way, there's a renaissance now that comes out of that. Similar connection can be drawn to the asbestos story out of 9/11 and the immediate aftermath of that and immediate attention after that. So what we were talking about in our table is when in the face of a threat that comes with an opportunity that can be leveraged, this room is an expert at knowing how to leverage that and get the most of it for the patient community. But then what? A few years down the road, when there's another threat, when it's climate change, when it's war, when it's something else, when the spotlight is no longer on that, how do we keep that from eroding away? And that's what Vanessa and I agreed we would just share some slides with you to end with what Pilla has also said and Anna has brought to your attention. Let's do something concrete. What can we physically do today to establish a system that prevents these things from eroding away? So just a couple of quick slides to maybe contextualize a little bit more what is happening around us. We've been talking a lot about NCDs. It's been the focus of this weekend, which is great, and mental health. But if we zoom even beyond that, we're operating in a time when we know global health is falling apart. It is a massive crisis. It's COPD, COVID, plus asbestos, plus 9/11 on steroids. And that will come with an opportunity. And that we're already hearing those opportunities. At last month's indeed, World Health Summit, this was the topic of the entire summit. It was, how can we take responsibility for health in a fragmenting world? And they meant politically fragmenting, but our health systems are fragmenting as well. And what is the responsibility, to your point, that we as patient organizations can take to show up as part of the solution? So that's a little bit of what we explored. The other thing I want to bring, because it's super timely, last week, this is a European meeting, last week, the European Regional Office of the WHO released its new work plan, 2026-2030. And what I want to highlight here is that both NCDs and mental health, as well as social participation walking the talk on people-centeredness are part of their new strategy. So it's an invitation to all of us as civil society and as patient organizations to show up, to your point, as partners to the WHO, to our health systems, etc., to help them implement this. So how do we think we can show up as partners to help implement? The Synergist hosted 2 sessions at the World Health Summit last month. This is part of one of we host many collaborative multi-stakeholder programs. One of our youngest programs is called the Patient Movement Catalyst. And the idea behind the Patient Movement Catalyst is it is a group of people like all of you, many of you in the room I've already spoken to about this movement, that is trying to create the conditions to help us be permanent, fixed, resourced, capacity built parts of the solution. And to be able to do that, we want to co-create the way that we're going to achieve that. So we had 2 sessions. I'm happy to share this with you after, and like Vanessa, there's a hyperlink here to the Patient Movement Catalyst website, where we started co-creating the solutions in Berlin last month, and we have an outcome report and invitation to everybody to join. What are the physical things that we can do? We need to obviously meet people through their hearts, through their minds, but also get them to work. So these are the 10 calls to action that came out of the co-creation session in Berlin, for which we are seeking partners to help. So anyone in the room, find me, find our colleagues, and help us create the evidence, help us build the campaigns, help us connect the dots, and help us essentially show up to the health system saying, this is how we can provide a service and bring an added value to the health system. This is what it is worth. This is what the evidence shows it's worth in cost savings and prevention. And this is the resource that it will take us and the capacity building that we need, that you can resource. So we show up as partners and social participants in the design and the delivery and the evaluation of care that will cost you less money, that will save you money and save you pain and help the community. So this is what we're currently in a open call to participate and work on. I think that's my last slide, so I'll leave it up for a moment and you can find my email on the bottom right. So as you can see, there's a lot moving that we're all doing.
Yeah.
And the big thing I think important for all of us to know is let's collaborate. Let's not move all of these things in silos and in our individual corners. Let's just join forces and do it together and understand how we can row in behind each other. How can we support the white paper for NCDs? How can we help the social participation agenda move forward? Because they're all linked. And maybe a final word, we know the WHO is a wonderful agency. They're currently struggling. It's an opportunity for us to partner with them and to help them through. And one of the things that we can help do is connect the dots between their work because they're very siloed. We've got so many outputs from the WHO that are relevant to all of us on mental health, on NCDs, on patient engagement, on community involvement, on social participation. We have a million departments that are saying the same thing with different words. We can connect the dots and we can show up to them and say, this is everything that you've been saying for the last 50 years. And this is how we can help make it a reality. So partner with us to make it happen.
That's great. Now we are wildly over time, so I'm going to have to be really quick in concluding this session. I hope you enjoyed it. I really subscribe to the concept of all teach, all learn. I really like the opportunity in these sorts of contexts to talk to each other. And the thing about hearts and minds, which is that slide that sits up there, is that the way we win hearts and minds is we tell a story. We tell a story. And I think that's what they're the sort of conclusions I've got today. What's the story that we want to tell at any level, whether it's the European level, whether it's the national level, the regional level, the local level, or for you as an individual patient? How do you then communicate that story? What's your evidence base? And that might be a systematic review, or it might be just your medical history, right? What's your evidence base and how do you hammer that home really quickly in a summarised form? Then how are you presenting it? It's Ravi's point. What are you using to present that evidence? What tools have you got in your kit? Really important to make sure you're presenting it in a powerful, compelling way. And then what does your audience need to hear? They're busy people, these politicians, these doctors. What do they need to hear? And what are your solutions? What do you want out of this? What's your end outcome? And then how are you going to implement it? We heard, didn't we, about Vanessa's white paper. She's talked in there about implementation. There's a lot of implementation science out there. So how are we going to implement the work that you... Then when we're implementing it, am I running out of battery?
Yeah.
When we're implementing it, what's the context that we're implementing it in? Don't sit in a silo. What are you thinking about, which is out there in the wider world, which could get in the way of what you're doing? Really got to think about that wider context and how you can be agile when you're implementing some of the work that you're doing. So, really good session. Thank you so much to all of our panelists. I hope you enjoyed it, and thank you for joining us.
Can I have a picture? If you just, if I just shoot my.
Sure, if you put mine down.
And then, just a picture.
Yes, going aprons, taken along.
Can I just steal one of these?
Yeah. On the way to the middle.
Yeah.
Okay, have a picture? Maybe thumbs up or something. Some exciting. Thank you.
Well, I want to thank everybody for coming. And we hope you enjoyed our first ever European regional meeting. We hope you found this valuable. I certainly would love that last session, especially. It is now lunchtime, and I want to just take a moment to thank all of our speakers, thank all of you for coming, thank all of our chairs, thank our staff, Rehan, Harris, Yusuf, and of course, our CEO, Hussein. Could we get a big round of applause for the WPA staff for putting this together? I want to thank my fellow board members for all of their volunteering and their time. And I want to thank, of course, our sponsors, Boehringer Ingelheim and AESGP. Without our sponsors, this doesn't happen. So big round of applause for them. Thank you, Vanessa. And thank all of you for coming. Mark your calendars for next November. We will see you in Nairobi, Kenya for our global conference. So November 7th and 8th of 2026, and followed by a fantastic safari. So come to Nairobi. Thank you, everybody. Let's go to lunch.
I'll check out from there. Please all check out rooms if you didn't do it, because it is high time first.